So the baby's coming. It's about a week until the baby's due. I know we've got a few days, but it could be up to a week. And so what are you thinking about? How are you feeling? How are each of you feeling?
It's been different, just the whole process of myself going through the changes. It's totally a new experience that I never thought I would have. We didn't plan it. It just happened, and the time was right. And God willing, it happened, so we said this is the right time for us. And we did it, and here we are, and it feels great.
Yeah.
I feel wonderful. I have all the energy in the world.
Yeah.
Yeah.
Prioritize 3 things. What would you put first that's really on your mind? You've been thinking about this. You're in the hospital. And what's the first thing that comes to your mind?
Breastfeeding.
Aha.
Not thinking of the pain or whatever labor comes. I'm ready for it. I'm going to let it be however natural, cesarean, whatever has to happen. I'm looking already beyond that into feeding him, nursing him.
Mm-hmm.
That's a big thing, breastfeeding, which I really want to do, and I hope I'm able to do so. So that's one. Secondly, diaper changes, because I've never done it before.
She's never changed a diaper
in my life.
Yeah.
And thirdly, my health, being able to jump back to my body size. I've gained 30 pounds, and it's all here.
All baby.
It's all here because I still retain my whole body physique, and I'm just hoping I could just go back to my normal self.
She's going to be great at everything. Like the breastfeeding, I just know it, and I have that sense. She's going to be a great mother. I could see the way that she's treated me since we've known each other, so I know she's going to be a fabulous mother. My only concern that I have is pain management for her during delivery. And one is I want to help her cope with it. And that was one of the main reasons why we wanted to take your class, is looking for pain management options. But also, I don't want to see my wife, who I love, in distress.
Yeah.
So it's going to be tough for me. I already know that.
Yeah.
I know that coming up. I can sense that.
Yeah.
So I know she's going to be a wonderful mother, but I'm scared about the pain management.
Yeah. Yeah. So what do you see yourself doing when you're there? She's going to be having some pain, and you've used the word options. You both know that there will be options to help with that, to help the coping. What do you see yourself doing? What's it like? What are you doing now?
Well, that's one of the things that's great about your class, was preparing us for the questions to ask the nurse, timetables, time factors. I knew what an epidural is. You hear about it in athletics or whatever. When does one get administered? You know, I didn't know what dilation of 0, 1, 10. I didn't know what any of that was. So learning that you don't walk into the hospital and get an epidural right away.
Right.
So I'm preparing myself. Let me just say that.
You've just done this most amazing thing together. Can you even begin to think about what that memory is going to be like?
You know, a piece of advice that you said in class, and I think, I don't know that you focused on it. It might have been more in passing, but it was profound to me, and it's something that I prepared for, is you said no matter, people have had great experiences in hospitals and tragedies in hospitals as well. And you said, let all that go and realize what you're doing today. You're giving birth, that this is going to be the greatest experience, the greatest day of our lives. And I thought about that for a long time, and I've truly prepared myself to think of that. And I'm excited about going to the hospital.
You've been great. This has been so wonderful, and so many people will benefit by what you've had to say today. Anything else that you can think of that would be especially helpful for people to hear from you?
If you haven't taken the class, definitely do so, because I was naive before I walked into the door, and I still may be, but I'm more prepared and know what to read, what to research. So it was a big help to know that these pain medications existed and that there's books out there, and then just knowing what the process is going to be like. So just knowing about it, like you had heard different classes, but definitely take the class because it's so worthwhile.
No, well, how long has it been since we've had the class? 2 months, right? So it's been 2 months, and it was really amazing to go back and watch the video, watch the class.
Watch the Best Birth DVD.
Yes. Oh, and I tell you, it's a lot. It's really interesting to go back through it. I've read your book. I've taken your class, and then I watched your DVD with a bottle of wine the other night. And it was enjoyable to sit back and to relax and to watch the DVD, but it was still very thought-provoking as well. I still worked up a
Well,
sweat
the class
watching
had
it.
already registered in. Now it's like, oh, okay, I remember that. Oh, let's practice it.
Okay, so it was a
That
good
was good.
refresher.
Refresher.
Sort of.
It was
Yes.
great, yeah.
Good,
Yeah.
good.
Yeah.
Well, that's good.
Yeah.
Well, I am so excited to meet this little baby Julian, and I know you're going to have the biggest event of your life for sure, very soon.
Yes.
And you keep me posted because I want to be one of the first people to welcome him into the world.
Are we going to come back in a couple weeks with Julian?
Yes.
He was little.
Yes.
That sounds good.
I would love that.
Thank you both so much.
Thanks, Sarah.
Thanks, Sarah.